Dr. Chatterley, I would like to talk to you about gum disease. Now, when it comes to gum disease, I hear most dentists telling their patient that you've got to fix the gum disease because if you don't, you're going to eventually lose literally all of your teeth. And while this is a bad thing in my humble opinion, and I'm very sure it's a bad thing in the dentist's opinion, and once the patient does lose it, I'm sure he thinks it's a bad thing. But let me ask you something. While you have a gum disease, in order to lose many or all of the teeth, that lasts 2, 3, 5 years, whatever. It lasts a while till it gets to that point. But during that time, you're having an infection in your mouth. Otherwise, it wouldn't eat the flesh away and the gums away and the bones away that you lose your teeth. So you have an infection. You have that yellow, reddish, ugly pus right in your mouth, right at the gateway of all the blood vessels. And minute by minute, for years, 1, 2, 5, 6 years till you lose all the teeth, your blood gets poisoned. I have heard that there is pregnant woman, a very high rate of getting premature birth, and by doing so getting underweight babies. I have even heard one lady dying, not the lady, the baby dying, because they found gum disease in her placenta. I have heard that heart attacks, strokes, we have heard that if this yellow pus goes down, it poisons the kidney, it poisons the liver, it poisons the whole body. My question is this, to make it short here. Isn't that poisoning of the body much worse than the losing of the teeth? Because at the very least, and you have mentioned, you dentists do a great job in replacing teeth with good dentures with implants, the fact is you can replace them. But how do you replace your liver, your kidney? How do you replace an underweight baby? Can you shed some light on that? Am I way off here?
Actually, you're not way off. More and more research has been coming with the reports in the journals and verifying and re-verifying everything that you've said. When I went to dental school, the first thing that the periodontal professor told us first day of his class is you don't have to floss all your teeth, only the ones you want to keep. And we say that and everybody laughs, but since that time, since 1978 and the 80s and particularly in the 90s, there was an extensive research into how gum disease is correlated with heart disease and the other various conditions that you mentioned, and verified by more and more results. And that's it's like opening the doors to infection and inviting them into your bloodstream is what periodontal disease, when it starts advancing, is absolutely just makes an open door for invasion of the bacteria and the toxins of the bacteria into the bloodstream. And then the results, because it's constant, 24/7, if the condition's not reversed, then it's going on, and the immune system of the body is trying to ward it off and combat it, but it's overwhelmed. And that's why we're seeing all these different conditions correlated to gum disease. Not to mention that in the more advanced gum disease, it's very miserable for the patient. They have ongoing periodic gum abscesses where the gums swell up and get very extremely sore and red, and they get swelling, and
I'm sure they get a smelly mouth too.
Periodontal disease breath can be detected at 15 feet, and it's not pleasant.
No. Well, you see, here's so I'm glad you confirmed that, because I don't think that most dentists put enough emphasis on that fact. Yes, the losing teeth is bad, but at least if a guy has 10, 20 grand, 30 grand to fix his teeth beautifully, as I said, he can put a Tom Cruise smile on it, no problem. But the point is, there may not be any gums, there may not be any bones available to do that anymore if you waited too long. But the point point is, in the meantime, you poisoned your body. And if it does something so devastating as what we said, underborn babies and heart disease and liver and kidney and all those things, wouldn't it bring the immune system down for the everyday swine flu, bird flu? Never mind the swine flu, the bird flu, just the everyday flu, which comes, 2-3 times a year these days?
Sure.
We wouldn't, fatigued, tired, exhausted, because
fatigued, tired, exhausted, your immune system's working hard just to combat the everyday 24/7 invasion of the bacteria and the toxins coming from the gum disease. So it's overworked, and you throw something else in there, the periodic flu virus, and it just doesn't have the power to resist.
Right. Well, because it's like with war, how many wars can you fight, from Afghanistan to Iraq and wherever, and then if another one comes up, well, where are the soldiers coming from? It's a little bit like that, right?
Yeah, exactly right. It's got everybody worried, doesn't it?
So, good. Well, again, people really should take care of it, because you see, I have heard that a gum disease is as big as your hand. And who would run around with a wound as big as your hand on your arm, on your stomach, on your head, wherever? I mean, if you just have a little, like a time of an infection and it doesn't go away for a week, you probably go to the doctor.
That's right.
Correctly so. Right. I'm not saying you shouldn't. Correctly so. But here you have like a fistful of it in it, and it's right at the gateway. Nothing is closer to the blood vessel, to the open blood vessel than the gums. As we know, when we take salt or anything we take to become alive again or to get high or whatever it is, you put it under the gum. Boom! It goes in the blood right there and then. And that's where your infection is. And you were not taking care of it.
That's right. Can't be emphasized enough. Periodontal disease, the more research they do, the more they see that it's correlated, the more important it becomes, and the more it's able to the resolving of gum disease is able to prevent conditions that were previously thought to just happen by happenstance, and they see a correlation. Now it's preventable. Right.
It's kind of like, and of course, sometimes in the body you don't know which causes which first. But the point is, if you don't know, you take care of both of areas. You just don't.
Absolutely.
I mean, it makes no common sense to have an infection in your body. Do you know what I mean? And in fact, I've heard that surgeons, these days very, very much catching on to that, because they stop doing any type of surgical procedure, if the person does have gum disease, knowing that the weakening of the system because of the gum disease is complicating their surgery.
That is right. We've had cases where somebody is getting prepped for surgery, and they send them and said, you need to resolve their periodontal condition. We're postponing the surgery until this is resolved. Absolutely.
Right. Yeah. Well, and again, if those drastic things, if the medical field, the surgeons, everybody catches on to that, if it can cause something so severe, thanks God not all the time, not everybody gets a heart attack because of a gum disease and all that stuff, but the point is, it brings your immune system down, so why not take care of the everyday thing, because you want to be in better condition on a daily basis if it can cause so severe problem. Well, again, I'm sure that the people watching that will come out with a renewed desire to go to the dentist. Bye-bye, Dr. Chatterley.
Goodbye. Thank you.